Hi, I'm going to share with you a movement assessment. If you've been in the clinic, you've experienced this at least once. It's something that we do every day. It allows us to see if there's any movement asymmetries, dysfunctions, that also allow us to see a global movement patterns of how your body moves. I'm going to invite Paul, and he's going to be my patient for the next 15-20 minutes. If I see some restrictions on him, I'm going to tell him what to do in order to help himself. I'll also explain what I'm looking for as I'm doing the assessment. This is so you can do this movement assessment in your home, on yourself, or on your family and friends. And of course, you can follow along with the drills, and then you can do them in your own home. Would you like to join me, Paul? Thank you. We're going to start with a quick posture assessment. If you'd like to turn around, if that's okay, facing that way. I'm looking at, he is obviously very good at his posture because he's been teaching this for quite some time. But as I'm looking at his spine, I'm sensing quite a bit of tension at the top and in the middle. And I know he's been doing some sitting recently, which I'm assuming will impact on how the middle part feels for you, Paul. You've got a bit of an asymmetry on your shoulder blade alignment. We'll need to correct that for you. And you've got your head slightly forward. That's because of some tension that we get into this area. So this is just some quick observations that we can immediately see. And from there, we're going to move on to a more personalized, specific test so we can see what exactly is restricted. Are you ready, Paul?
Yeah.
Now, I'm going to talk you through what I need you to do. If you have pain, please tell me. I'd like you to look straight ahead, as tall as you can, and if you could bring your feet together, even better. Okay? First thing, I'd like you to point your chin all the way down to your chest. Okay. Any pain in your neck or in the middle part?
No.
No. Okay. You're really looking to see how free the movement feels. As you get closer to the end, does it feel restricted in these areas, which could all be signs of tension and tightness in here or in here. Do you one more time? We're looking to see, can Paul touch his chin to his chest? And he's got a bit of a gap, so we'll consider that as an imbalanced and asymmetrical movement dysfunction. When you're ready, I want you to look all the way up to the ceiling. Do you have any pain with that, Paul? No. Okay. You can see that his ear and his face is not quite parallel to the ceiling. I'm expecting some tension in the top part and probably in here, which will be confirmed once we do some palpation skills. But again, for yourself at home, as you do the movement, be very aware of how it feels. Is it easy to go there? Do you feel like you're restricted, like there's grindiness in the joint as you're looking to do the movement? If so, you might be having an imbalanced and dysfunctional movement pattern. We're going to do the next two for your neck, Paul. When you're ready, I'd like you to look all over to your left shoulder. Okay. Any pain with that?
No.
Okay. And here you're looking for the chin to be reaching at least the mid-clavicle. Turn around so we can see all the way the other side. That's perfect. And if you can look over to your right. That's it. You're much better on your right-hand side, Paul, than on your left. Okay. Any pain with that?
No.
No. So again, you're looking to be able to go as pretty much mid-clavicle. So far, if you turn around, Paul, going down, chin to your chest was limited for you. Looking up the ceiling was slightly limited. And then looking to your left was limited as well. So those would be the things that I would like to improve on you. My prediction is, because you're so tense in this area, if you could turn around, you're so tense into this area of your spine that it's actually making it harder for your neck to move. So correcting this will allow for a better movement in your neck. You ready for the next two movements on the shoulder? Now, if you turn with your back at the camera so we can see, we're going to take your right arm, put it behind your back, and aim to touch your shoulder blade. When you're ready, any pain, discomfort with that?
No.
And we're looking to be able to reach with the fingers the inner angle of the shoulder blade. Arm down. And can we do the same on the other side? If you can touch here. Lovely. Any difference left to right as you did it?
Feels
Easier on the left. That's exactly what I'm seeing. And you can put your arm down. And when you're ready, take this arm above your head and touch here. Okay, any pain with that?
No.
and down, and do the same on the other side and touch here. Any pain with that?
No.
Any difference left to right?
On the right side and the left side.
Then the left side. Okay.
Opposite back, opposite
Good.
back.
The movement is good on both sides for Paul because he can reach the points that we're after. However, he can feel a difference left to right. I can see a difference in the quality of the movement left to right. And again, that is letting us think that it's not an actual problem with the shoulder itself, but more with what's happening in the middle part of the spine. And the tension that we've got on here, it's actually restricting the movement, the quality of the movement coming from the shoulder. Well, later on, we'll give you some things to do to see if we can improve these patterns. If you face to your left-hand side, please, Paul. Now, the next movement, if you could put your feet together, bring your arms all the way up, and I want you to reach go forward and reach for your toes. Go as far as you can. Tell me if you've got any pain.
No.
Any pain? No. Good. Come up. Now, here what we're looking to do, one, can we touch the toes? That's the first question. Second, how easy, difficult it is to get into that motion. Number three, as a practitioner, we're looking, do we have enough movement coming from the hips, the pelvis? Do we have a nice arch happening from the whole spine? Or do we get some areas of restriction? Could you do that one more time, Paul? Mm-hmm. Getting nice, good shoulder movement. We've got good hip hinge for Paul. Obviously, he knows. He almost reaches, but where I see the tension is in his middle part of the spine. So far, all the asymmetries that you've got, Paul, and I can see, are taking me back to the middle part of the spine as this being the primary area that we'll need to focus in order to get you better, freer, and moving with more confidence. Ready for the next one? Mm-hmm. Any questions so far for me? No? We'll keep your feet together. We'll get your arms all the way up, and we're looking to arch backwards. Okay, and here we're looking quite a lot at the arch of the middle part of the spine, and he's very, very limited on that. And come back up. Any pain with that, Paul? No. So far, again, it's this area that we'll need to treat for you from everything that we're seeing. And it makes sense because you've been doing a lot more sitting recently. So the joints in the middle spine have almost stiffened up into a slightly open position, going into the opposite movement, which is extension, the one that we've just done. We're asking the joints to do the opposite and go into a closed backwards position, and they're not really comfortable ready to do that. So mobility in this area will help you massively. But we'll test that shortly. Mm-hmm. If you could turn around and face the camera, keep your feet together, arms by your side, and turn your body all the way to the left, aiming to look. That's it. Any pain with that? Okay, and same on the other side. You could do that, and we'll compare left to right for you. Better on the left? Better this one?
I can't feel much difference.
You're going much further on the left. Can I just move to see, do it one more time on the right-hand side when you're ready? Some more. Okay. Okay, so here we're looking to see the top part moving, and then also the pelvis and the lower part moving as well. If you do it in between two corners for yourself, you want to be able to see the opposite corner as you turn, and then same on the other side. But be very careful because it's very easy to move your neck too much in order to compensate for the movement. If you're too stiff, you will feel it on here, or you'll feel it if you turn around for a second, Paul. You'll feel it in here, the middle, or in the lower part if you're restricted. So your body will tell you what's going on. We're going to face to your right. We're going to turn around. We're going to do the other movement, and we're going to do it in two different ways. Is that okay? Mm-hmm. We'll keep your feet together. We're going to put your arms in front of you, and I want you to squat as low as you can from here. Very good. And then I want you to drop your arms by your side, all the way down. Good. And come back up. And we'll do it differently as well. Put your feet apart if you can. Get your arms all the way up, and then go down into a squat. Lovely. Okay, good. And just to make it easier for you, try the same movement but with your arms across your chest. And I'm really looking to see what's happening in the middle part for Paul. Okay. Easier this time?
Yeah.
Yes. Okay. And come back up. I can see with all these 3 different ways of doing the squat, Paul has good hip hinge, which means he's using movement coming from there. The first one, you could see clearly that this is where the limitation is coming from. The second one, still on here. The third one, when you had your arms across your chest, we made it easier for the middle part, which allowed you to go even deeper into the squat. Turn around and face the camera. How did it feel doing all of this?
Third one was obviously easier.
Easier.
And I could feel it was taking the strain off that area.
Of the middle part.
Also, some pain in the knees.
Okay.
Which would be thrown up in the course of doing this.
On the very last one, you're looking to see how far can you go. Think of a good squat movement. You're looking to have your hips going backwards, and you certainly don't want to lean too forward, because those are signs of middle part of the spine restrictions, which we see in the clinic for a lot of people that have seated type jobs, office, driving, anything relating to sitting. So far for you, Paul, you had dysfunctional move. You had no pain, only in the knees with the very last one. If we would have had pain on any of the other movements, then we need to treat the pain pretty much straight away in order to reduce that, then review the movement assessment. You didn't have any pain, middle, top, neck, lower part. With all the movements we did, the first one was restricted, top one was restricted, left one was restricted. I think that's all coming from the middle part of the spine. When you did the shoulder, you did it okay, but the stiffness you've experienced on the right, I think that's still correlating to the middle part of the spine. And then the last ones that we did with flexion, arching backwards, and rotation, again, that's where a lot of the limitation is coming for you. Same with the squat movement pattern at the end. So what we'll do for you, I'll do some drills to self-mobilize the middle part of the spine. Mm-hmm. And then from there, we're going to retest the movement and see if we feel a difference.
And I have a question.
Yeah.
I'm sitting at least 4 hours, 5 days a week.
Mm-hmm.
I've been aware that making a slight adjustment to my screen changes the focus of the discomfort I feel in this area.
Yes.
What advice have you got at any point? Because I think I need to do something with that.
We'll answer that question after we do the drills, if that's okay. Because we'll do the drills, we'll reassess the movements, and you'll be able to tell us how you feel. Mm-hmm. And then afterwards, we'll answer the question, which will be part of what you could do for yourself day to day. Okay? Now, the first thing I'd like you to do, we're going to turn around so everyone can see. Mm-hmm. You're going to take your hands and put them behind your head. Okay? And I'd like you to open, first of all, I'd like you to open the elbows as much as you can. Because you've got the hands in this position, this is really putting a bit of stress and tension in the middle part of the spine, getting the joints to move in the opposite direction that they're stiffened at the moment. And from there, I want you to arch a little bit backwards. So look towards the ceiling and arch backwards. That's good. You're okay with that? Mm-hmm. Remember, you don't need to go very far. Just a tiny bit in there will be enough. Good. And back on. Lovely. And then one more time. And this would be something that you could do throughout your day for sure, and you're self-mobilizing in here. And I'll probably do that no longer than 3-4 times. Very gentle, smooth movements, so we get this area changing. Okay, and one more. Lovely. You're okay with that? Mm-hmm. And you can put your arms down and relax. What we'll do after each drill that we do, we'll reassess some of the movements because I want to see to which one your body's responded best, because that would be the number one thing for you to focus on. Mm-hmm. And that's always the best thing to do. You notice you've got discomfort, you're doing something, you immediately reassess in order to see what's helping your body and what's the minimum dose that you need to do from that particular drill in order to help yourself. And the one I'd like to do is going forward and touching your toes. We'll bring your feet together again and get your arms all the way up. And we're going to aim to reach for your toes. The way we did it earlier. Very good. Good. You're going a tiny bit further. How did that feel this time, Paul?
Actually felt easier.
Easier. Okay.
It's no surprise.
Don't lie to us. Good. You're clearly going further. It's still not enough for us to see the movement I want to see in here, but it's making a difference. So that tells us this is something you could do fairly easy on your day-to-day. And I'll probably every hour, I'll do 3 to 4 repetitions of this, sitting or standing. I think that will benefit you. Okay, are you ready for us to do another one? Okay, this will be a little bit more dynamic, and we'll also combine some rotation movement patterns, which will be a little bit challenging for your brain, and I want to see the difference this makes. We're going to have one leg forward, one back, if that's all right. Okay, lovely. I'm going to put your palms together. We're going to make sure you're tall, so we're going to get your ears up to the ceiling. Okay, now this arm, because you've got the right leg forward, I want you to slide your right arm all across your chest, and as you come towards your chest, I want you to move. Okay. Okay.
Like this?
That's not what I was thinking, but that's still okay. Good. I'll help you. We're going to slide this arm across towards your chest, and when you reach your chest, I want you to rotate your spine so you're looking this way.
There's a reverse archer.
That's good, but the name is not that important. And come back in. Lovely. Very good. We'll do that one more time. If you can. Lovely. And you're clearly incorporating some breathing, which I like. Come back in. And the third time I do it, when you move, I'm going to move around so you can see me, if that's okay. If I'm this way, is that all right? As you're sliding your right arm, I don't want you to keep it in a straight plane. I want you to rotate as you come towards your chest, and then you can move it back straight. That's it. Lovely. Very good. And what we'll do, we'll swap legs and arms once you're done. And then we're going to do the same on the other side. You're okay with that?
Yeah.
We're going to do 2 repetitions of forward plane motion. When you're ready. Very good. Very good. Nice. And back. This is a bit challenging for your balance as well. I can see it's getting your middle to engage. Very good. And the third one, we'll do it with a rotation motion to start with. Very good. How are you with that?
Good.
Comfortable?
Yep.
Okay. When you're ready, we're going to come to the position we were in earlier, feet together. And when you're ready, we're going to get your arms above your head, and we're going to go forward and reach for your toes. Very good, and very good. How was that?
Well, I'm touching the floor.
Yes, you're going a bit further, that's sure. Tell me how it felt, how easy, comfortable it felt to go towards there.
Odd, because actually just getting into the position felt better.
Better. Well, that means everything we've done so far, it's helping create movement in this area, which immediately allows for shoulder movement to improve. Less pressure from the middle part as your arms go up, which obviously, and then the end result, easier to go down and reach for your toes. Pop your arms down. We'll check the neck movements, if that's okay, to see what impact it had on that. When you're ready, if you come face that side, that's good, but come a bit closer to the wall. Lovely. And nice and tall, and we're going to point your chin all the way down to your chest. Okay. All right, and come back up. We'll do that one more time. I want to see how we're on here. Okay. Okay, I think that looks better. Did you feel better? Yeah? It looked smoother to get into the position, not as struggling like earlier. Look up to the ceiling. Let's see that one. Okay. Okay, I think that looks very slightly better. And come back up. I think we'll need some work in the actual neck area to improve the extension. It's just a little bit better. And your left rotation was limited, so let's see that. Okay, I think that's better. You're almost perfect, but we've got some work that we'll need to do here to lengthen in order to allow your neck to go fully there. Okay, and look straight ahead. Turn your back at the camera if that's all right, and we'll do the shoulder movements. And we know that the right side felt stiffer before, didn't it? So if you take your left one first and put it behind your back. Very good, and down, and we'll do the same on the right-hand side. We reach here. How did that feel?
I need to do something at some point here.
Okay.
Internal, external.
The movement still looked different left to right-hand side, but you were able to reach slightly further on the right side this time. But I agree, there's still a difference. So in this case, we'll need to assess the shoulder specifically in your case, because we've improved the movement on here. We're still experiencing some discomfort limitation from the shoulder, and we need to go and assess the shoulder and see if there's any structural problems or any tissue problems around the shoulder itself. And let's look at the big one, which was arching backwards, if that's okay. If you face to your left, so we can see you from the side, arms up, and then arch backwards. So look all the way up towards the ceiling. Okay. Good. Actually, that's much better, Paul. A lot better. Feels different? Okay. And up. Very good.
It's very different.
Well, your two things that you could immediately do at home, because I'm also thinking what's the minimum time that you're going to take from sitting down and doing the work in order to not end up at the 4 or 5 hours of sitting feeling stiff and in discomfort. And this will only take 20 seconds. I think that's how long we've done it now, and we could see an immediate improvement. So maybe 20 seconds every hour for the long of period that you're sitting down. That will help to maintain and improve the movement in the middle part of the spine.
Thank you.
We'll do movement with your arms up one more time, because you're so good at doing it and you know exactly what you're doing. Sometimes we see in the clinic, could you do it wrong, Paul? We see a lot of the movement coming from the pelvis. All of this goes forward, and we're overextending from here and then from here, and we're not really engaging the middle part. So Paul didn't do that because he knows what he needs to do, but let me guide you on doing it correctly for yourself. So you're going to get your arms back. We barely see any movement happening because we're not overextending from the neck and we're not pushing the pelvis too forward. So almost if you had like a piece of string on here that's pulling you up and driving this part to arch backwards in that motion. So all the movement that's happening is in this part, nothing too much on here and nothing too much on the neck. So think the chest being driven up towards the ceiling, engaging rotation that way into this part of the spine. Let's do a sit-stand movement pattern. We'll do it very slowly. The chair is here, but I want you to pretend, or I want you to think that there's no chair and you have no idea where the chair is. So in other words, I want you to go very slowly down in order to feel the chair. And when you feel the chair, don't sit on it, come slowly back up. Okay. And this will be the same as if you're doing a slow squat up and down, training your glutes and your core. Very good. Slow, 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 slow. Good. Very good. Very good. And come back up. Nice. We'll do that one more time. I'll take the chair away and I will tell you to start and stop if that's okay. Yep. When you're ready, start. Go, 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 and stop. Go down. Stop. And go down. And stop. Come up. Stop. Up a little more, stop, and up a little more, and all the way up. This is a very good type of drill that you could do anywhere. It's allowing your good core activation. It's allowing you to work your glutes and then the leg muscles as well. And then also work on your posture, because if you have bad posture, you're going to end up aching in the wrong places, and then that's your body's way of telling you that you've done something wrong in order for you to look at ways to correct it. So you don't need to be in the gym. You could be in the home, in the office, and then just practice this. It presupposes that you have good hip hinge movement and you can do the movement correctly. Because if we do it badly and we do it slowly, but all leading from the knees, all you're doing is creating more tension on the knees, more weight bearing on the knees, which with the time will irritate and cause pain. Try this, see where you're at, see if you can do it. Can you do it well? Do you ache in the correct places? And the correct places to ache would be your glutes and then down the legs, because you'll be using those muscles. If your knees ache, if your back aches, it means you're doing something wrong. Maybe film yourself, watch this video compared to what you see yourself doing, and then you can take it from there. We've done the movement assessment, which is at the core of what we do when you first come in the clinic. Like I said earlier, it gives us a big overview of how your body moves, where you are restricted, where the dysfunctions happen, and from there we can see how best we can start your treatment. You've seen me doing it on Paul. You can pause, play as many times as you want, so you can do this for yourself. And it doesn't take long. I think it took 15-20 minutes for us to do it. For a lot of us, you will see limited movement in the middle part of the spine. And I encourage you to try the drills as well, reassess yourself, see how it feels. And of course, if you have questions, please give us a ring, send us an email with your findings from doing your own self-assessment, and then we'll be able to help you find the answers, find maybe a personalized treatment plan for yourself.